when and how often should you get a mammogram? Doctors have updated their guidance. They actually lowered the age for when that should start happening. And this, of course, made headlines when the U.S. Preventative Services Task Force recommended that women get mammograms every other year starting at the age of 40. So I'm joined now by two fellowship-trained breast imagers, Dr. Rachel Pricer and Dr. Andrea Lamphere. Thank you both for being with us.
Thank you so much for having us.
Well, yeah, let's just jump in and start talking about what this additional training, this fellowship-trained breast imager means. What is that?
Absolutely. So a lot of people don't realize when you come to get a mammogram, the person who's taking the pictures actually is not your doctor who's reading it. So they're just very highly specialized trained technologists who know how to get the pictures. Afterwards, a doctor actually reads it. And so after you go through medical school, you do 5 years of additional training specifically in radiology, and then fellowship is after that, and that is optional. So that's an entire year where all you're doing is learning about breast health and how to detect breast cancer and other breast diseases on imaging. So when you look at the numbers, that's 5 times the training that a general radiologist would have. And when you're talking about finding breast cancers at their smallest and their most treatable, having that extra training is crucial to be able to pick up those small millimeter changes. We know that screening mammograms save lives to the tune of about a 40% reduction in breast cancer deaths since we started using screening mammograms. And the reason that is because when we find things when they're small, they're treatable, and we're catching that cancer before it can have a more of an impact for that patient's health.
That expert eye, that's exactly what you'd want. Mm-hmm. Let's talk a little bit, Dr. Lamphere, about these changing guidelines, because we're talking about a different age than it used to be.
Right, exactly. So 40 is the age that is recommended. However, there are some nuances to that that's important, and they change them honestly quite frequently. It's even hard for us as experts to keep up. But 40 every year is what a lot of the like American College of Radiology, which is what we are a part of as radiologists, we feel it's the safest to do 40 every year and to really catch cancers at their smallest size, like Rachel said, when we have the best chance of actually saving a woman's life.
Making a difference.
Exactly.
Absolutely.
And as far as screening mammography, that study has always been covered by insurance, 100%. Anywhere you go, there will be no out-of-pocket costs. It's hard for us because a lot of women don't know that, and they avoid getting their screening mammogram because they're afraid they're going to have to pay. And that has already been covered. But in Iowa, we actually recently passed some hugely important legislation that is going to help with some adjunct imaging. So if patients are high risk, and Rachel mentioned this, Dr. Pricer mentioned, we really recommend for every woman at age 25 to find out their risk. And that is something, I know we didn't have that, not many women are getting that. And we want to really promote that so that people are aware. And the best part about this new legislation that was actually passed bipartisan, unanimous, which is amazing, right? Hardly ever happens. They will cover all of that adjunct screening at 100%, like a screening mammogram now, which is so important for our women, so they don't have to choose between paying something and finding out if they have cancer.
So you two teamed up on that. You're also teaming up on a really exciting project later this summer. Tell me about it.
Yes, we are delighted to be able to bring a new service to the women in Central Iowa, and actually men too. Men have breast problems too. Right now in Central Iowa, there is no place that you can go where you are guaranteed to be seen by a fellowship-trained breast expert. There are over 80 radiologists in Central Iowa practicing. Less than 10 of them are women. Less than 5 of them have fellowship training in breast imaging. So when you go in to get your mammogram or your breast MRI, the chances that an expert is reading it is very low. And so we want to change that. We want something different for ourselves as patients and also as physicians. And so we're opening Grace Breast Imaging and Medical Spa this summer in August, so that when somebody comes to see us, they are guaranteed to have that fellowship expertise looking at their mammogram no matter what.
All right, we are out of time, but it's a very important conversation. Dr. Pricer, Dr. Lamphere, thank you so much. Good luck this summer with Grace.
Thank you.
And the medical spa, it's perfect.